Bismillahirrahmanirrahim. This video will describe the general consideration about the bone tumor. The bone and cartilage tumor together are termed as bone tumor. Primary bone tumors per se are less common than the secondary bone tumors. There are about 2400 cases per year of primary brain tumor in United States. Although they are rare, if encountered, these tumors are associated or result in amputation, disfigurement, disability, and survival in these cases is less than 50%. Some tumor types have inclination for long bone and a specific site in the bone. Some tumors tend to affect metaphyses while some affect diaphyses. These tumors are age specific also. Some tumors affect the children, some adolescent population, and some are specific for older people. If not causing obvious lesion, benign tumors are diagnosed incidentally, while malignant tumors present with pain, mass, or a pathological fracture. The radiologic imaging for the bone tumor is important to localize the lesion, and the histopathological study is essential for the definite diagnosis. This classification schema is corroborating the statement we just made that each tumor has got some predilection for a specific age and a specific site. The two major groups of these bone and cartilage tumor are osseous and non-osseous tumor. The osseous tumor are further divided into 5 heads. Some form bone and also termed as osteogenic, bone forming or osteoblastic tumor, while some form cartilage, hence termed as chondrogenic tumor. Some tumor from the marrow are termed as hematopoietic tumors. Some tumors are of unknown origin, and there are notochordal tumors. The common benign bone forming tumors are osteoma, osteoid osteoma, and osteoblastoma, while the malignant counterpart of the bone forming tumors are classical osteosarcoma and surface osteosarcoma. The common benign cartilage forming tumor are enchondroma, osteochondroma, chondroblastoma, and chondromyxoid fibroma, while the malignant tumor is the chondrosarcoma. The malignant tumor arising from the hematopoietic tissue are myeloma and lymphoplasmacytic lymphoma. The tumor which has got unknown etiology, the benign counterpart is giant cell tumor or osteoclastoma, while the malignant counterpart of this giant cell tumor, Ewing sarcoma, adamantioma. Then the malignant tumor arises from the notochord or chordomas. The non-osseous tumor recapitulate from the tissue which is present surrounding this bone tissue. Some arises from the vascular tumor termed as hemangioma, and the malignant counterpart, then the fibrogenic tumor, fibroma, fibrosarcoma, neurogenic tumor, and so on. So in the remaining part of our videos regarding the bone tumors, we will follow this schema of the bone tumor, which is dependent on the osseous tumor only. The non-osseous tumor will be described in detail in the soft tissue tumors. By now we can conclude then for the diagnosis of bone tumors, certain parameters are very important to know to properly categorize the lesion. These are the age of patient, location of the tumor, radiological appearance, histological features of the tumor, biochemical and hematological parameters. The age is probably the most important clue for the diagnosis of bone tumor. When classifying the bone tumor, we can divide the bone tumors in various age groups. The common bone tumors in the younger age group of 0 to 20 years in benign category is non-ossifying fibroma, fibrous dysplasia, simple bone cyst, aneurysmal bone cyst, osteochondroma, osteoid osteoma, osteoblastoma, chondroblastoma, chondromyxoid fibroma and eosinophilic granuloma, while the malignant counterpart are Ewing sarcoma, leukemic involvement, metastatic neuroblastoma and osteosarcoma. The bone tumors affecting age group of 21 to 40 years, the benign tumors are enchondroma and giant cell tumor, while the malignant tumor of this 21 to 40 years age group is chondrosarcoma. The bone tumor which are affecting 40 years and above age group, the benign lesion is osteoma, while the malignant lesion in the 40 and above years age group is metastatic tumor, which is the most common one, and myeloma, leukemic involvement, chondrosarcoma, osteosarcoma, malignant fibrous histiocytoma and chordoma. As stated earlier, the site of the long bone involvement is also important, as most primary bone tumor, they have got a favored site within the long bone. And this is an important clue to the diagnosis. Some of the tumors, they tend to affect diaphyses, and these diaphyseal lesions which are centered in the cortex, the example is osteoid osteoma. Some metaphyseal tumor are intramedullary lesion. One of the example is osteosarcoma, and it is usually centered in the metaphysis. Chondrosarcoma and fibrosarcoma often present at metaphyseal lesion. Osteoblastoma, enchondroma, fibrous dysplasia, simple bone cyst, and aneurysmal bone cyst are also common in this area. The metaphyseal exostosis, the example is osteochondroma. Then the diaphyseal intramedullary lesion is Ewing sarcoma, while others are lymphoma, myeloma, and this site is also common for fibrous dysplasia and enchondroma. The metaphyseal lesion centered in the cortex, the classical location for the non-ossifying fibroma and osteoid osteoma. The epiphyseal lesion are chondroblastoma and giant cell tumor, and they are invariably centered in the epiphysis. Chondroblastoma is a rare tumor, and it is seen in children and adolescents with open growth plate. Giant cell tumor is the most common tumor of the epiphysis in a skeletal mature individual with closed growth plate. Giant cell tumor often shows metaphyseal extension also. So this diagram is summarizing the previous picture, which is depicting that the common epiphyseal tumor, benign epiphyseal tumor, are chondroblastoma and giant cell tumor, while osteoid osteoma, osteoblastoma, osteochondroma, enchondroma, chondromyxoid fibroma, non-ossifying fibroma, giant cell tumor, and aneurysmal bone cysts tend to occur at or near metaphysis. Common benign diaphyseal tumor are enchondroma and fibrous dysplasia. The Malignant tumors of diaphyses are Ewing sarcoma and chondrosarcoma, while clear cell chondrosarcoma tend to locate at epiphyses. The metaphysis is affected by osteosarcoma, juxtacortical osteosarcoma, Ewing sarcoma, and chondrosarcoma.